Thank you, Professor Fadi. And my talk is about head injury in pregnancy, challenges and care. I think it's very special, case because not many we face a pregnancy with a head injury. Yes, maybe we remember that there is some issue before about the issue of gender and outcomes, how hormonal status influence the outcome, and you can see many journal, many reported cases, many article that talking about this hormonal status influence the outcome of TBI. And yes, if you know that uh, uh, some of the reported journal before is mentioned that progesterone is one of a strong neuroprotector before. So it means that in pregnancy maybe there is some beneficial situation that could be have some advantage for recovery in trauma. And this is one article in 2023 about the traumatic brain injury during pregnancy. And it said that it's associated with increased rate of cesarean section. Very interesting. The main finding of the study were that the incident rate for TBI during pregnancy have remained similar during our study. And TBI during pregnancy, even a mild one, is associated with an increased rate of cesarean section, especially TBI during the third trimester, with high rate for cesarean section. So I think it's some physiological consequences to in traumatic brain injury that influence the condition of the fetus. Yes, head injury in pregnancy have a very specific scenario because we face with a different physiological condition, dealing with two lives and different outcomes, and require multidisciplinary approach. So we have to, deal with the different and specific management, of course. And like I mentioned earlier, that in 2007, the study protect a randomized clinical trial of progesterone for acute traumatic brain injury was developed in that time, and they have some hypothesis that the progesterone have a protecting and rebuilding the blood-brain barrier, decreasing development of cerebral edema, downregulating the inflammatory cascade, and also limiting cellular necrosis and apoptosis. But after some trial, they say the Protect 3 was stopped for futility when no statistically significant difference between the progesterone treated and placebo group were found in mortality or at the primary functional GOSE. So, and also in New England Journal of Medicine, saw no clinical benefit of progesterone in patients with severe TBI. Yes, this is very important physiological condition that we have to know that how the physiological alteration of pregnancy and their effect from cardiovascular, respiratory system, hematologic, GI tract, and also the condition of uterus and placenta. You can see the effect is susceptible to hypotension, susceptible to hypoxic hypoxia, altered response to inhalation anesthetic, susceptible to anemic hypoxia, increased risk of aspirin dangers, and also susceptible to hypertension and decreased brain perfusion. So it will, affect the condition of traumatic brain injury. So we have to know about this. And the other side that there are many reported many research about the how hormonal aspect during the pregnancy and of course during the head injury, because severe trauma stimulates catecholamine release, which causes in uteroplacental vasoconstriction and compromise fetal circulation. So some article report that 40% of moderate severe head injury demonstrated hormonal derangement because of hypopituitarism with growth hormone and gonadotropin deficiency. So this is will increase risk of loss of pregnancy. So yes, the rapid assessment and evaluation is yeah, similar, but you can see with the expose of the patient, we have to measure also the fundal height, we have to measure the fetal heart monitoring, and also make sure the gestational age determination. A is fetal basic assessment. So yes, this is very important to, we have to know that we regularly use this kind of drug, but in pregnancy, this kind of drug is, is very dangerous to the fetus. Fetal dehydration because of mannitol. If you use hyperventilation, so uteroplacental vasoconstriction and fetal hypoxia will happen. And phenytoin, I think if we use it in the first semester of the pregnancy, it will have teratogenic effect, and also anesthetic agent has a dose effect to the fetus. This is the record of our case in our hospital. Not many case, but you can see we have around 11 case with a different treatment and different outcome. Yeah? Craniotomy simultaneous with cesarean section, and conservative treatment, only craniotomy, and the other is only cesarean section, and the other simultaneous craniotomy and section cesarean. The the outcome is, you can see some with severe head injury, the Glasgow outcome scale is very good, excellent. We don't know about that, yeah. So this is a record from our cases. So I don't know. It's because of hormonal factor or something else. I don't know. And we published an article, I think, last year about systematic review epidemiology and management outcome of the pregnancy and head injury. You can see in this review, mostly TBI and pregnancy occur in low middle income country. Yeah. In developing country, traumatic brain injury is the major contributing factor in non-obstetric mortality among pregnant women. The most common type of injury was motor vehicle crashes. You can see it's almost in low in middle income country. And also, we compare with the other country, the other institution, it's great variability in the treatment of pregnant patient with TBI between institution and countries. And we can see we develop our own criteria algorithm management of severe TBI, but I think it's it's from our hospital, because you can see the gestational age also our consideration, and we have a cut point of 28 weeks, because it depends on the on the facility and the expert in neonatal unit. So they give us some advice that in our institution it's it's safe for cut off point of 28-week gestational age, because that time we have to decide for simultaneous cesarean section, that the baby the prediction of final baby is good in this 28-week gestational age. But I think it's different with other institutional with a good neonatal unit support. And this is case one. You can see I will show you the three cases with different scenario. This is a severe head injury case with a herniated one. I'm sorry. Thank you very much.